What can we do better in the home? Because we know healthcare in the hospital is incredibly expensive. Everybody's trying to figure out how do we push healthcare back to the household where the patients want to be anyway.
Patients getting access to care and providers being able to service those patients. What do you think needs to change?
We saw nursing shortages. We saw nurse support supply drop 30% during COVID, projected to fall another 25-30% over the next few years. We see, incomprehensibly large nursing strikes. We need to draw the line between hospitalization and home at a place further to the left. We need to be able to get more of our patients cared for at home. Every realm of healthcare personnel is thin right now, unfortunately getting thinner, so need some answers, some good answers.
We're not utilizing patients. They're being dependent on others. So if we can give them the tools to be successful at home, we can completely rattle the entire healthcare system. And by doing that, it cascades the entire model of care. And that's going to be very interesting in the future when you have that integration of home-assisted robotics, then you have pharmacy, then you have the patient engaging in their own health and wellness, and then you have the providers finally being able to do their job, but strategically based upon where the patient needs to be served.
You bring healthcare back to the home, or to the home, which is really what you're focusing to do. And what's the technology that brings the consumer-centric part to healthcare? And then how can you bridge the gap for that last mile of care at home?
Amazon just came out with a drone that delivers medications within 60 minutes. That's going to completely change the delivery of medications to the convenience of people like you and me in the home. So what do you think the cascading effects are? Fully integrated systems like a Walmart, like a CVS, like a Best Buy, like an Amazon, all getting into the pharmacy game. How is that going to impact people?
I think some of it's buzz. Like, is a drone going to be sexy enough to be like, oh my gosh, I'm now going to be adherent to my medications? I feel like if we spent more time figuring out how to get people on a healthier diet, and actually if they need to be taking Ozempic, we're probably in a better place than just prescribe. There's not a lot to tweak in my opinion. It's access, it's driving adherence, and it's cost. Like whether my mail lady from USPS delivers it or a drone, like I don't know. Is a plan sponsor going to switch to Amazon because a drone's delivering the? That's the real question, right?
What if you definitively knew the exact medications, when they took them, when they didn't?
These are the meds that you've taken over the last week. It can show taken. Now I know exactly what you're taking. I know what you're missing. The term medication reconciliation is an incredibly important facet of healthcare delivery right now. We don't have time for. I think the biggest part of healthcare post-hospital is, are you doing what the physician or provider practitioner wants you to do? But most are not. So we need better systems, definitive ways to show, prove, and then report to the provider that indeed they're doing it. If they're doing it, I've got a lot more work to do. If they're not, it's an easy fix.